Dr. J here. Today we are going over ways to lower your cholesterol. So I'm going to go through root causes of high cholesterol. I'm going to get into what foods to avoid, and then of course the mighty supplements. What do we take? Okay, so let's get started. All right, so 5 root causes can be, number 1 would be your thyroid function, your metabolic health. How good is your metabolic health? So we got to look at the thyroid. Number 2 would be insulin resistance, leptin resistance. So how are our blood sugars? What's happening there? Because it is a response of inflammation in the body over time. The next would be infection. Okay, what kind of infections am I having? Do I have a low-grade infection that's quiet that you don't even know about? Which would be bacteria, viruses, parasites, that kind of thing, which rolls into the 4th one, which would be leaky gut, the intestinal permeability. Is it intact? And then last but not least, number 5 would be genetics. So are my genetics, my predisposed genetically? Okay, so those are the 5 root causes. There are probably more, but they're the ones that I see the most. Okay, and then we go to what foods should I avoid? Okay, so foods you should avoid. Okay, sugar, refined carbohydrates, junk food. Again, the average person consumes 160 pounds of sugar a year. So that just lays down tons of inflammation, increasing your LDLs, increasing your triglycerides, and decreasing your HDLs, which are the good cholesterol, okay? Okay, so the second, number 2 food to avoid is alcohol. Sorry, period, end of story. I won't even get involved much beyond that. Yeah, so it is a nice glass of red wine is really great in antioxidants, okay? However, it's loaded with sugar. So anyway, need I say more? Alcohol is out. Caffeine is number 3. Number 3 would be the mighty caffeine. So 1 to 2 cups a day should be your max. Tea, any kind of tea as well. Green tea, though, has high antioxidant properties, so that's a much, much, much better choice. So, just take a little challenge here and see if you can wean yourself off of coffee and start with green tea, hot or iced. I'm an iced fan every day. Okay, and then trans fats. Okay, your hydrogenated oils increase your triglycerides, your LDL, decrease your HDLs. Tons of studies. You can check that out as you like. If you want studies, always ask, because I'm Mrs. Analytic. I love studies, okay? And then, I'm going to get into omega, as supplements go, I'm going to get into omega fish oils, fatty acids. Omega-3, 6, and 9, you need to have an omega check. When I'm checking on inflammation in the body, I will order a blood test called the omega check so I can see what your omega-6 to 3 ratio is, okay? Most people is like 16 to 1. Omega-6s are the bad choices at that high. It shouldn't be that high at all, okay? It should be 4 to 1 should be the ratio. So you want to know where you are in the omega check with the blood work, because that will give you an idea of how much omega fish oils you need, okay? Your fish oils, your omega-3 fatty acids specifically, okay? All right, so what you need to know about the fish oils, the omega-3, EPA, DHA, okay? EPA, DHA, fish oils, okay? These babies, the fish oils, they penetrate your arterial walls and they slow down the damage to the walls. So it's important, right? Not only that, they reduce the risk of damage and rupture in the arterial walls. They decrease your blood pressure, nice side effect, and it also increases your HDL. So omega fish oils are my first go-to always. All right, so second would be CoQ10. All right, 200 to 300 milligrams a day decreases your LDL, which is your bad cholesterol, and your triglycerides. Okay, perfect. Okay, then we move on to niacin. So listen up. Okay, niacin, not niacin straight, but not in the form of niacinamide. Okay, that's B3. Niacinamide will not cause your body to flush like you're having a hot flash, okay? We don't want that. So you take it in the form of niacinamide, so you avoid that, okay? So that would decrease your triglycerides, that decreases your LDL, and it increases your HDL. Tons of studies on that. So red yeast rice, okay, is fermented white rice. The studies are out. It's 1,200 milligrams in divided doses, and it decreases both triglycerides and your LDL. Okay, so bravo for that one. Okay, so next is garlic. Okay, garlic, 500 milligrams, decreases your LDL. So those are my top picks for helping you decrease your cholesterol levels across the board. But I also just want to throw in there, don't forget about the mighty fiber. Okay, you get fiber from just eating all those green leafy vegetables, just dense fiber, soluble fiber. It would be 14 grams of fiber per 1,000 calories that you consume a day. Okay, that is very important because fiber helps to control your cholesterol levels and your fats, and it just binds to it and just poof, out of the system it goes. So lots of water though when you increase your fiber, for obvious reasons. We don't need constipation. And then if you're having digestive issues, then it's a whole nother game you have to play with, you because you have to nurture your belly. But I'm talking just to lower cholesterol that you didn't even know was high. Also HIIT exercise called HIIT, high intensity interval training. Yes, like 4 or 5 times a week. Spend 15 minutes doing HIIT exercises as well as begin strength training. You will win and you will bring your cholesterols down. So be it, okay? So I believe that should just about cover my little cholesterol information for the day. Thank you, of course, as always, allowing me to help you take your next step together towards health. Please don't forget to subscribe. Click on the bell to get your weekly reminders. Feel free to always ask if there's any way I can serve you. I am here to do that. Bless you. Enjoy your day.